and namaste everyone. My name is Nistha Prasai Pokhrel. I want to take a moment to thank all of you for being here today. Though we are far from home, our Nepal, we stand together and united for a cause much greater than political feuds, ethnic differences, and personal agendas. We stand for humanity, for our loved ones, whom are first-handedly experiencing everyday life struggle and pain. They're losing hope for better days to come. They're waking up every morning not knowing whether they're going to be able to provide food for their children. And every night they go to bed with questions and uncertainty of what tomorrow will bring, if there is a tomorrow. The economic blockade imposed by India is sabotaging the supply of essential emergency goods from getting to hospitals and health clinics, in which those that are dear to and close to us go to in seeking medical care. India's barbaric acts in breaching international laws against basic human rights is consequently denying our Nepalese people of life-saving healthcare treatment and services. 60% of Nepal's pharmaceutical drugs and medical equipment are imported by Nepal, most of which are supplied by India. The remaining 40% are made in factories located inside of Nepal. However, those have been forced to shut down due to the political crisis. It's been reported that 350 cargo trucks carrying medicines have been left stranded at key accessing points. Vehicles that do manage to get through the border and ambulances carrying the sick are getting vandalized, arsoned, and bombed before ever reaching to the health facilities and hospitals. Hospitals across the country, including National Heart Center, have had to cancel as many as 40% of scheduled surgical procedures due to an acute shortage of health personnel and supplies. At this rate, it's been reported that medical supplies will no longer be available in 2 weeks. Nepal's Red Cross Society stockage and supply of blood bags are rapidly depleting, and yet the consumer demands for it and needs are on the rise. The Himalayan nation is struggling to provide vaccinations to hundreds of women and children. Vaccinations that prevent this vulnerable population from falling ill to an array of deadly viruses. According to the National Center for AIDS and STD Control, they've not been able to access antiretroviral medications that were previously readily available to patients diagnosed with HIV. Lacking the fuel crisis and blockade is ultimately impacting the Nepalese people's general health, well-being, and overall quality of life. Lacking nutrients, fruits, and vegetables in their daily diet is causing the people of the nation to become more susceptible to health conditions. Lastly, I want to emphasize with you and stress that not even the decades-long armed conflict, not the political transitions, or the devastating earthquake that took more than 6,000 lives have had an impact as much as the economic blockade imposed by India has to the health and quality of life of our Nepalese people in the last 2 months. Thank you.
Thank you, girls. हामी यो अर्गनाइजरहरू के भन्न चाहन्छौँ भन्देखि यो